Hi, my name is Natalie. I'm going to be your nurse today. I'm going to perform hand hygiene and wash my stethoscope to practice infection control. I want you to know that we are in a private and safe location today. Can you please state your name and date of birth for me?
It's Tara McCutcheon, July 10th, 1986.
Great. And do you know where you are located right now?
At UNE in Portland, Maine.
Good. Patient speech is clear and they're oriented ×3. I am now going to tell you 3 words to try to remember, and I'm going to ask you again later what they are. They are chocolate, dog, and surf.
Okay.
Okay. If you wouldn't mind, just go ahead and close your eyes for me. I'm going to check for body sensation. I'm going to touch you in a couple locations, and if you'll just let me know where on the body I am touching you.
Left lower leg. Right upper leg. Left lower arm. Right upper arm. Left cheek.
Good. Open your eyes. Patient body sensation is good and intact, but able to locate each location that I was touching. Next, I'm going to test for fine motor skills. If you would take your fingers and touch each of them to your thumbs. Good. Patient's fine motor skills are intact, was able to complete the task without any issues. Tara, are you in any pain today?
No.
And do you use any assistive devices?
No.
Good. Patient's speech is clear and oriented ×3. I'm going to check for some cranial nerve functions. If you would give me a big smile and a frown, puff your cheeks out, and raise your eyebrows for me. Good. The cranial nerves are intact. Patient was able to complete each of those without any issues. Okay, I will now have you stand up.
Okay.
And if you could walk to the green block right there and turn around and walk back for me. Good. You can turn and stand right here. The patient's gait is good. She was able to walk without swaying or tripping, picked up the legs properly. I'm now going to assess for balance with the Romberg test. If you could close your eyes and lift your arms out straight in front of you. Good. Put your arms back down, please. You can open your eyes again. The balance is strong and the patient was not swaying from side to side. And the coordination is also intact and strong. If you could lift each foot now, and I want you to place your foot to your shin on the other side. Great. The other foot as well. Good. Patient's balance is also strong, was able to complete that without any problems. Gross motor skills also seem to be intact. Okay. I am now going to do some range of motion assessments on you. If you would bring your arm straight out to the side and then rotate it in a circle for me. Good. I feel no crepitus in the left shoulder. And I'm going to have you bend your elbow now. Good. No crepitus in the elbow either. And roll your wrist around for me. Good. No crepitus in the left wrist either. The skin on the left arm is warm to touch. It is dry. It is pink. The radial pulse in the left arm is a +2. And her capillary refill was under 3 seconds, showing good oxygen perfusion to the limbs. And her turgor, the elasticity of the skin is good as well. She seems well hydrated. And I see no clubbing of the fingernails. They are clean and look healthy. Okay, I'm now going to assess the right arm. If you would bring your arm out again and rotate it in a circle for me. Good. And now for the elbow. Good. And roll your wrist for me. Again. No crepitus in any of those joints. The fingernails look good and healthy on the right arm, on the right hand as well. No clubbing. capillary refill is under 3 seconds, showing good oxygen perfusion. The elasticity of the skin for Turger is good as well, showing good hydration. And her right radial pulse is also +2. No rates of abnormalities, a bilateral +2 rate. The skin of the arm is pink, warm to touch, and dry. Okay, if you would raise both of your arms up right out in front of you. Yep. And if you could push up for me. Good. And flip your hands over. And now push up this way. Okay, and flip them over one more time. Sorry, and push down. Good. Put your arms back down. Patient strength in the upper extremities is a 5 out of 5. We're now going to do a range of motion in your legs. We'll start with the left leg. If you could raise your foot straight out to the front. Good. Back down, and then out to the side. Good. There's no crepitus found in that joint, and your knee. Good. No crepitus found in the knee either. And roll your ankle for me. Good. You can step this way just a little bit. I'm going to do the left leg. Okay, if you could raise that out to the front. And then out to the side. No crepitus found in that joint either. And your knee, please. Thank you. And your right ankle. Good. No crepitus found in any of the joints on the right leg either. The range of motion in the upper extremities and both lower extremities is full. The skin of the legs appears pink, warm to the touch, and dry. I'm going to now check for, oh thank you, if you don't mind removing your shoes. I'm going to be assessing her feet and look for the pedial pulses, so roll up these pants for you. Assessment, looking at the feet, the skin is pink, it's warm to touch, and it is dry. The toenails look healthy. There is no clubbing of the toenails. Capillary refill in the toes is under 3 seconds, showing good oxygen perfusion to the feet. And now going to assess for your pedial pulses. The dorsalis pedis pulse is bilateral +2, and no rates of abnormalities there. And the posterior tibialis pulse is a bilateral +2 as well. Good. You can continue standing for just a little bit. If you would pretend that you're diving into a pool, I'm going to assess your spine. Upon palpation, the spine feels straight and normal. There are no signs of lordosis or kyphosis. You can stand up slowly for me. Good. Upon rising, she stands up straight. Her posture is good and strong. There's no swing to either side. And the spine seems healthy. Okay, you can have a seat for me, Tara. I am now going to assess your head. I'm going to start by taking a look at the hair. Put some gloves on for this part. Assessing the hair, I am seeing that the hair is equally distributed. I also see no signs of bumps or lesions, rashes, excessive dandruff, or any lice or critters or anything like that in there. Seems very good. I perform hand hygiene. Again. Okay, by looking at the head, I can see that it is in proportion to the rest of the body in size. The eyes are symmetrical, the eyebrows, there is an evenly distributed hair supply there, as well as the eyelash. eyelashes. The skin of the face looks pink. Okay, and it is dry and warm to the touch. I'm going to start by palpating some sinuses on your face. If you have any tenderness or pain, just let me know. Okay. Any pain with any of that? Good. The frontal and maxillary sinuses were palpated without any pain or tenderness. Also going to check for your lymph nodes. Good. I do not feel any enlarged or hardened lymph nodes, meaning that there's no sign of infection. If you could swallow for me. Good. Patient was able to swallow. The thyroid is not enlarged. Upon inspection of the neck, the trachea is midline and erect. The skin looks good, warm pink and dry. If you could, I'm going to check for the range of motion in your neck. If you would tilt your head back and to the front and then to each side. Great, and if you could keep it up just like this and then turn and look to each side as well. Good, the range of motion in the neck is strong. She is able to perform each of those duties without any pain. Was there any pain with any of that? Good. No popping or other abnormalities. Also going to assess for TMJ. If you could open your jaw for me. Good. There's no signs of crepitus there. No popping with the jaw. So I don't see any TMJ problems. Okay, while I'm here on your neck, I'm going to assess your carotid arteries, starting on the left side, and then to the right. Okay, both carotid arteries are palpable, and there is a +2 strength of a pulse bilaterally. I'm also just going to take a listen to them. Good. Upon auscultating the carotid arteries, I don't hear any signs of roots or whooshing. No abnormalities with that. And again, they were +2, just like I felt. Okay, I am now going to start with the ears. Upon palpating the ears, I don't feel any lumps. The skin is pink, warm to the touch, and dry. To look inside. I don't see any excessive drainage or earwax. I'm going to whisper something into this ear if you'll let me know what I say.
Cat.
Cat, good. And then upon the patient's right ear, again, on palpation, there's no bumps, rashes, lesions. The skin looks warm, pink, dry to the touch. Take a look inside this one. Again, no signs of excess wax or drainage. I'm going to whisper something into this ear if you'll let me know what I say.
Puppy.
Good. Patient was able to perform the whisper test without any issues and correctly heard the words that I said. Have you had any problems with hearing?
Nope.
Recently? Good. Okay, I will now assess for the eyes. Upon inspection, the eyes look properly placed on the head. They are symmetrical. The sclera is white and the iris is blue, and the pupils are about 6 milliliters in diameter. I'm going to pull down your lids just to look at your conjunctiva. Everything looks healthy. They're pink and moist. Don't see any signs of drainage or pus or any infection going on in there. Okay, I'm now going to do a couple of tests to check for your vision. Have you had any problems reading close up or far away?
No.
Okay. If you'll first follow my pen. Follow one more time to your nose. Good. The patient was able to complete the 6 fields of gaze without moving her head and follow the accommodation test with the pin light to her nose without any issues. I'm going to assess for pupillary responses now. Good. Both pupils constrict consensually upon light. And the eyes seem to be in good health. We're going to move down to the nose now. Upon looking at the nose, it is properly proportioned on the face, symmetrical, the skin looks good. Don't see any irritation, rashes, anything like that. Have you had any problems smelling anything recently or breathing in and out of your nostrils?
Mm-mm.
Good. We'll first check for patency. If you would close one nostril and take a breath in and out. Good. And the other side. Good. Any issues there? Good. The patency of each nostril is good. Patient is able to inhale and exhale through each nostril. If you would lift your chin for me and look back, I'm just going to take a peek in here. There's no excess drainage, and I see no signs of a deviated septum. Okay, moving to the mouth. Have you had any issues with taste or sensitivity to hot or cold?
Nope.
Okay. The lips are pink and moist. You would open up for me. Good. The mucous membranes inside of the mouth are pink and moist. She seems well hydrated. You stick out your tongue. The tongue also seems well hydrated. I see no abnormalities there. Normal color. The teeth appear to be clean and no signs of stains. Could you say ah? Good. You can close your mouth for me. The uvula moved upon the sound, and the tonsils are pink. The uvula was midline, didn't seem deviating to either side, and the tonsils were not enlarged. There's no odor in the mouth no foul odor. If you could stick out your tongue one more time, and then go from side to side with it. Good. No signs of a past stroke. The tongue looks to be in good health. Okay, I believe we are done with the mouth. All right, I will now assess the heart. I'm going to first palpate the precordium. Good. Upon palpation, I do not feel any murmurs nor any lumps or other abnormalities. I'm going to now take a listen. Auscultating. I'm first listening to the aortic valve. Okay, and now the pulmonic valve. These are found on the second intercostal space. The pulmonic is left of the sternal border, and the aortic is on the right of the sternal border. We'll now listen for Erb's point, which is found on the third intercostal space. Okay. And for the tricuspid valve, which is found on the fourth. I'm also going to listen to my bell with my bell on that one. And also the mitral valve. On that one as well. That is found at the fifth intercostal space. There are no signs of an abnormal rate or rhythm. I hear no murmurs or irregular heartbeat, arrhythmias. The heart seems to be in good health. The skin on the chest is also pink, warm to the touch, and dry. Okay, I'm going to have you stand up one more time for me. I'm going to check your lungs. You can turn and face this way. Upon inspection, I don't see any signs of a barrel chest. I'm going to have you take a deep breath in for me. Good. The patient's lungs seem symmetrical. She is able to inhale and exhale deeply and there is at least an inch of chest expansion, showing that the lungs are filling with air, and she is also exhaling that properly. Okay, I'm going to take a listen to your lungs when I place the stethoscope on your back. If you'll just take a deep breath in for me. And if I'll turn around, I'm going to listen anteriorly as well. Good. Upon auscultating the lungs, they are clear. I do not hear any sounds of wheezing or crackling, and she's able to take big, strong, deep breaths. Okay, I'm going to have you sit back down. You can actually lay down this time. I'm going to be listening to your abdomen. Do you mind if I pull your shirt up? Great. Upon inspection of the abdomen, the skin is pink, warm to the touch, and dry. I don't see any bumps or lesions, enlargements, rashes, anything abnormal on the abdomen. Okay, I'm going to take a listen in each 4 quadrants. Gurgling, keep your shirt for 1 second. There's gurgling heard in each quadrant. I'm listening to bowel movements. I'm listening to digestion. I can hear feel the pulse of the renal arteries. I can hear that in there. I'm going to listen to her vascular sounds as well to make sure there's no signs of an aortic aneurysm. Good. And I listen to that in the epigastric region. I hear the pulse, but it is not bounding. It seems normal. There's no signs of an aortic aneurysm. I'm also going to palpate the stomach. If you palpate the abdomen, if there's any pain or tenderness with any of this, just let me know. Okay. Patient shows no signs of pain. I'm palpating the abdomen and I feel nothing abnormal there. Okay, you can sit back up for me. Tara, do you remember the 3 words that I asked you at the beginning?
Chocolate, surfing, dog?
Yes.
Okay.
Very good job.